Let's find out more now. Let's cross live to our guest, Neomi Bennett, who's an NHS nurse who's been working on the front lines of the pandemic. Welcome to the programme. It's good to see you. Neomi, give us a better idea of what the situation is on the ground. How severe is the lack of PPE and how is that affecting your work, as well as the morale of you and your colleagues?
Yeah, so basically, I tend to work in not one specific hospital. So I do sort of agency nursing. I work in different hospitals across the NHS. However, I've noticed personally that there's a very big difference between hospital to hospital. So, for example, the most recent hospital I worked in, I was given a basic surgical mask when I've been looking after COVID-19 positive patients, whereby the guidance actually says that I should be fitted with proper PPE filtration mask. When I tried to bring this up to like senior staff, I was told that this is how they do it at that particular trust. So it kind of makes it's very uncomfortable.
So what do you think's gone wrong here with the government's strategy in supporting the NHS?
It's quite difficult to say because, like I said, different hospitals are doing different things. So it's not like there's a set framework that all trusts are following. I think that's probably what the issue could be. So if there was more central guidance and trusts followed the same pattern, then maybe that would be a way to solve it. But like I said, the particular hospital that I worked with, they were not prepared to supply the basic surgical mask. However, I did see that some staff were able to get a PPE filtration mask in some circumstances. I was actually working with 2 patients that were tested positive, and I was supplied with a surgical mask, which will not protect me when I'm in the room with a patient and they're coughing and spluttering. I didn't feel comfortable with that. But like I said, when I raised it as an issue, I was told that that's how they do it in that particular trust.
The Health Minister has spoken out and said that healthcare workers are free to speak their mind. Do you believe that?
Not really. It's very difficult. Like I said, I found myself in a position where my own safety was compromised. But I think a lot of healthcare workers, we do tend to work more towards better outcomes for our patients. So it's putting us in a situation where we're almost forced to be working unprotected. It's very difficult when you know that the outcome of a patient could depend on you leaving the shift to make the department short.
As someone working on the front line, how do you expect the pandemic to play out in the UK? Do you think enough is being done to contain the outbreak?
For me personally, I believe that people are not listening to the guidance of staying at home. And the problem is that there's so many conspiracy theories going on. The general public are not taking this seriously. So that seems to be a real problem. On social media, I'm listening to people say that it's not true, it's fake, it's, you know, all these conspiracy theories are actually diluting the wider issue. And people really just need to stay at home. If you stay at home and keep yourself contained, it will help the virus to die out. But obviously, at the moment, I personally do not believe people are listening. I do work as a nurse currently. I pass several commons and parks on my way to work, and I see people having picnics, flying kites. You know, to me, it's like the general public are just not taking it seriously.
Do you feel that's why people like yourself who work in healthcare, who work on the front line, feel the need to go onto social media to talk about what you're experiencing?
Yeah, I think that as well, because I don't discuss it on social media so much, but even between my small networks, whenever I speak out, the general public don't believe what I'm saying. When I say that people are dying, because the sounds of the inaccuracies on social media seem to be having more of an influence. So I think it's really good if people are allowed to speak on social media, but obviously that's not the case at the moment.
Neomi Bennett, NHS nurse, thank you for speaking to us today, and
You're
do
welcome.
stay safe.
Thank you.